Hi, my name is Don Hughes and welcome to another of the COGTRIUM short training videos. This one is particularly around telehealth. First question is, what is telehealth? There's a lot of terms out there and they all mean the same thing, whether it's telepsychiatry, teletherapy, teledoctor, telemedicine. They're all talking about the same thing. The idea is that patients and providers, therapists, can be brought together over the internet using a webcam, an internet connection, and a microphone, and being able to talk and carry on therapies. The ability and the implication of that is massive. If you stop and you think, how do I extend the four walls of my office to where I'm impacting more people? How do I make visits more convenient? The CDC has been tracking for a number of years missed office visits. It's amazing to look at that every year as it comes out. On the low end, there's 5% in a handful of specialties, and those tend to be the surgical specialties down at the bottom, and it goes up to 50%, with a big bulk of providers and therapists having 30 to 40% missed visits. If you look at that, that's a huge waste. And in your own practices, I'm sure you've tried to address, how do we make that happen better? Well, one of the primary problems is that people have to travel to you. If you're in a large urban setting, your patients may be spending hours on the road, having to face parking, and it is just not convenient. And traffic itself is a killer of time and making people late and everything else. The convenience is a major factor. The other thing is that many therapies can be delivered as effectively, or in many cases even more effectively, over the internet using our telehealth platform. Privacy is a significant issue for many people. If you think of the kinds of things that are going on with privacy, what the HIPAA regulations and others was to limit the use of information. You remember all of the things where the regulations came out on sign-in sheets and who can see what on what's computer screen? Those are all still in effect, and they're all effective with telehealth. But there's a step beyond that. Let me give you an example of a patient, 57-year-old man, stroke victim, supposed to have speech therapy with a therapist to be able to bring back his speech abilities. Well, first visit, he's at the speech therapy office. Took him an hour to get there. He's not the best of mobility people because of what's went on with the stroke. And sitting there in the waiting room, because the speech pathologist group that he was attending also dealt with children, which most speech pathologists do as well. And he's sitting there with these kids and looking at these toddlers that are there for delayed speech. And all he can think of is, I have lost everything. I have been reduced back to being a child. And it's devastating, and he refused to go back. He was able to use telehealth, where the treatments and the sessions were done in the privacy of his home, with his caregiver, in this case his wife, being there with him. Comfort level was huge, and the privacy concern wasn't just how the doctor was going to use his information, but how it made him feel about himself. Telehealth has that ability. If you think of the family counseling issues, so much of that, doing that in the privacy of your home, not to have to go and sit in a waiting room looking around wondering what's going on with these other people and hope I don't see a friend. You know, it's that kind of thing that's very real for many people. Patients really like telehealth. It makes a difference. We'll talk about how to detail certain types of therapies and things that can be very, very helpful in other videos. Please look at our frequently asked questions page, the resources that are there, and if you have any questions, go through the support process and let us address them. We appreciate you looking and listening and thoughtfully thinking about this video. Thank you.